The first few days are just kind of physically getting close to back to normal, you know, eating and sleeping well. So physically, we want to take care of them right away, and that's the emphasis when you come.
Typical day starts off when they get up in the morning and they rise kind of early, and guys that have been here for a few weeks, they meet every morning at 8 o'clock and they find out who the new guys are. Can we get some books, take to them? Can we help them? Can we get them a cup of coffee, show them where the dining room is? Monday through Friday, 10 o'clock is usually where they go to their primary group. They meet with their counselor. They sit in a group and they kind of look at the obstacles and the struggles they've had and how to overcome them.
You start at very basic things. We teach people about what the disease of alcoholism and drug addiction really is about, physically and with the brain and what it does. Give them some educational tools to allow them to make some decisions on what they need to do for their own recovery.
And I think that every human being that walks this planet wants to be connected. They want to belong. And a sense of belonging is what we need out there.
When we bring people down here for music, there's a lot of different ways to use music. Individually, though, a lot of patients have come down here and they just hold on to their guitar, play for a little bit. I might play a song or they might play one, and then they start to talk. And talking is a good thing for everybody.
We tend to isolate because we don't want the shame and guilt. And a lot of that is wrapped up. So we try to help them peel back the layers of the onion and get down to what the core is. Because for a lot of people, drugs and alcohol are not the problem, they're the solution. And we got to find a different solution.
The idea is to let them begin a discussion about what spirituality and higher power is for them personally. Their families are falling apart. There's no anchorage there. Their personal life's falling apart. Their belief in themselves is falling apart.
As early as they can remember as a child, go back to that safe place, right? Go back to that safe place, and with their eyes closed, they go back there. Picture that safe place. Now I say, as an adult now, I want you to walk back through time and put your arm around that young person, that little boy or that little girl, and whisper in their ear, it's not your fault. And a lot of times that is a cathartic moment for somebody to realize that we do have that inner child and we need to get back to that.
So we give them something to anchor themselves to. And anchorage means love, means feeling safe, and then ultimately it means having these tools to, when you leave here, you know that you got to anchor yourself to something, because we not only want them to get well while they're here, we want them to stay well.
That's one thing I like about Cumberland Heights. They don't just pat you on the head and send you on your way. They want to make sure that you've got a plan, a continuing care plan for when you leave here. We don't pray for a calmer sea, we pray for a stronger boat. And we make our boat stronger here.